Good evening and welcome. I'm Dr. Jason Beckrow, and I'm very proud to be the Medical Director of Caring Circle, Spectrum Health Lakeland. I'm very pleased to be talking with you tonight on the topic of living better with a serious illness, an overview of our services and the benefits of palliative medicine. November is National Hospice and Palliative Care Month. I am very proud to work for an organization that has been serving our community with hospice services, as well as palliative services and many other services for now several decades. In the time we have tonight, I'd like to talk briefly with you about those services and how we can work with you to help care for our friends and neighbors throughout the community. I'm going to advance the slide here, or at least I'm going to try. I'm not sure if I've been given control yet of the slides. If someone could help. Oh, I see something there. Let's try it now. There we go. Sorry for that little hiccup. If that's the worst bump we have tonight, it'll be a great night. As we are all learning in the world of a worldwide pandemic, we learn to adjust as best we can. Briefly, Caring Circle, our vision and our mission statements are on the screen above for you to see. It is our goal to create a world of meaningful moments by focusing on quality of life, embracing aging, illness, and dying, the death process, as well as grief healing as part of living. One of our goals is to help demystify or make the word hospice a little less scary and really to convert it to a word of hope. Our mission statement is to serve the elderly and the seriously ill, as well as their caregivers and all of those who need us with dedication and compassion. I try not to be too conceited, but when it comes to the folks I work with, I have to tell you, I work with an incredibly compassionate, dedicated, and just a wonderful team of loving caregivers. Our goal is to deliver meaningful quality of life care and support and help people experience life and death according to their values and to their wishes. And we work hard to guide our youth, adults, and families through the caregiving and grieving processes with timely and consistent availability. My next slide here it comes, is to look at what now truly is a caring circle. Several years ago, in fact, in the early 1980s, what is now Caring Circle was first founded as what we used to know as Hospice at Home. And if you can see my cursor here in the 6 and 7 o'clock position of the Caring Circle, you'll see hospice care. It is the foundation of our organization. Hospice at Home has provided care for the sick and dying in our community for over 30 years now. But if we're only providing hospice care at the end of life, are we missing the opportunity to serve more folks? And over a decade ago, we said the answer to that question was yes, and can we do more? And since then, we have added our palliative care team, which I'm going to talk a little bit more about what palliative care is and the services we can provide. Our bereavement services, our transition services, adding social work support to families in need. House calls, which is in-home primary care for folks who find it difficult to leave the home for medical reasons. And then, of course, our beautiful Merlin and Carolyn Hansen Hospice Center in Stevensville. We'll go to the next slide here. And what exactly is palliative care? A lot of folks understand what hospice is. Hospice is providing comfort care for folks at the end of life. But again, when is the right time for hospice? When is it too soon? When is it too late? Palliative care aims to be a bridge from acute care to hospice care. The word to palliate means to relieve, in this case to relieve suffering, be it in physical form, in the form of emotional distress, spiritual distress, what have you. Some definitions are provided there. I'll read from that. The World Health Organization recognizes palliative care as an interdisciplinary medical caregiving approach aimed to optimize quality of life and mitigating suffering in all its component forms among people with serious illness and complex illness. Palliative care is oftentimes employed, with diseases such as cancer, cardiovascular disease such as congestive heart failure, cerebral vascular disease, neurological diseases like Parkinson's disease or folks who have had strokes, but can actually be used for all life-limiting or serious illness concerns such as diabetes and things such as that. The goal is to work with a team of professionals to provide comprehensive care, so you're getting the best medical care and the best supportive care concurrently. And we walk a journey with you. We build a relationship. We work hard to earn your trust so that when things change, we'll be there with you to help you make sense of those changes and to help you make the choices that are right for you. Our next slide here, which will be coming up momentarily, is again talking about hospice care. This is pure palliation or pure palliative care, again, at the end of life. The beauty of a hospice care team is its comprehensive and interdisciplinary nature. A hospice care team includes doctors and nurse practitioners and physician assistants, as well as an RN that works as a case manager. Our RNs will be coming to our patients' homes oftentimes at least every 2 weeks, weekly, or sometimes more. Other members of the interdisciplinary team include a nurse's aide, social workers, for those who are so inclined, spiritual care or chaplain services. We have massage therapy, we have volunteers. The goal is to build a safety net under the patient and the family caring for that patient so that when things change, there's a lot of folks there to add support. When things literally go bump in the middle of the night, they have a number to call and we can be there to help. Our next slide is just a graphic showing the beautiful Merlin and Carolyn Hansen facility in Stevensville, a 16-bed facility that was the dream of our initial board of directors in the late 70s and early 1980s. And it is now truly a special place in our community. It opened in 2013. And hundreds, if not thousands, of patients and their families have been cared for in this facility to provide a place of refuge and support at a very trying time. Oh, I think I went the wrong way. Let's see if I can get my slides to come forward. I apologize, folks. It's a little sticky here. There we go. So we've now talked about palliative care and hospice care. We, again, offer other service lines as well. Transitions is a program that aims to provide social support to folks, to help folks coordinate between doctors' visits, to find the resources that they need, to help explain diagnoses and medical options and other resources that may be available within the clinic, checking in on folks periodically. And again, volunteer services can also be offered. Our next slide is coming up. Here it comes. House calls. This is a relatively new program at Caring Circle, and it is in-home primary care. It cares for patients with serious and chronic illnesses who are no longer able to get to their primary care doctor's office. We bring the care to you in your home. We aim to work with you wherever home may be. We have a lot of patients that are in adult foster homes as well as assisted living facilities. Again, the goal is to bring a comprehensive team of officials, of health professionals to the patients to get the care that they need when they need it. Part of that then again is to build a trusting relationship that will bridge transitions throughout the patient's care needs. Bereavement care, just real briefly, is the concept of we're caring for your loved one. Your loved one has passed away. It doesn't mean our work is done. We're there to support you through the grief process through at least 13 months after the passing of your loved one, to get through anniversaries, holidays, birthdays, and things such as that. A beautiful team of professionals. And I think I have a slide here that talks about Lori's Place, another place where we provide bereavement care. I'll try to advance the slide one more time. And here it comes. Lori's Place has been with us for now, I believe, over 15 years. Started by the generosity of the Schultz family. Lori Schultz was a physician in our community who sadly died at a very young age and left behind grieving children and husband. And they have been so extraordinary at recognizing the need for good bereavement care in our community. Lori's Place is a wonderful facility in St. Joseph, caring for children, adults with support groups, and now the facility extends to schools, elementary, middle, and high schools all throughout our service area in several counties. I'm going to advance the slide here one more time, and here it comes. Another service that we're very proud of is how we honor veterans. As you know, we have so many veterans in our area, and to provide them with the respect and the dignity and the gratitude for their service, it is truly an honor, and to recognize their services and to give closure at such a critical time in one's life. Next slide will be coming up here, and there it is. The last service I want to talk about tonight is advanced care planning. What exactly is advanced care planning? Some of you may recognize the terms living will or advanced directive. The goal of advanced care planning is multifocal, but most importantly, to help all people retain autonomy through their entire lifespan, including at times when they may not be able to make decisions for themselves, by either giving direction to family and medical care teams, or by designating those loved ones that you would want making medical decisions for you if you should become incapacitated. It's for anyone ages 18 and up. It's a free community service, and we can work with you to not only have your desires, your values, and your wishes be known, but ways to memorialize that, to have it encapsulated within documents that are legal and binding, and again, help you preserve your autonomy throughout your entire life.